Hi, I'm Dr. Pathak, cataract and vision correction surgeon. Cataracts are a normal part of aging, but unfortunately they can cause a lot of problems with your vision. They can cause blurriness, fogginess, glare, difficulty with seeing street signs, and at some point they will require treatment, and usually that treatment is a surgical treatment called a cataract surgery. So congratulations on taking the first step. During your cataract consultation, we will have an opportunity to learn about what symptoms are bothering you, whether you're having difficulty with reading, driving, watching television, or if your vision just doesn't quite feel the same as it did in the past. We'll have an opportunity to examine your eyes, and usually that involves using light rays and taking some scans of your eyes to better understand how your eyes are treating light rays and to better understand how healthy are your eyes. Once we have a better idea of how advanced your cataracts may be, we can spend some more time talking about the whole cataract surgery process and preparing for the actual procedure. Cataract surgery is an outpatient procedure. It usually takes about 15 to 20 minutes, and it's done at an outpatient surgery center with the help of an anesthesiologist. Usually, plenty of eye drops are used to numb your eyes during the procedure, and the anesthesiologist gives you medicine through an IV to make sure you're really relaxed and comfortable during the procedure. And most patients tolerate the procedure very well and go home with a clear plastic shield protecting their eye. For most patients, they notice a pretty big improvement in the quality of their vision by the very next day, and that might include seeing colors more vividly, being able to read street signs that they couldn't read before, or being able to read a book where they couldn't do it before. During the actual procedure, what we do is remove that cataract that is causing the cloudiness and all of your symptoms, and we replace it with an artificial lens. That artificial lens is meant to stay in your eye for the rest of your life. The good news is the artificial lenses that are available on today's market are amazing, and the technology has advanced quite a bit. So we have a lot of great options for treating nearsightedness, farsightedness, astigmatism, for increasing the range of your vision with new technology lenses that are called trifocal lenses or extended depth of focus lenses. Oftentimes people will have an opportunity to reduce their dependence on glasses after their procedure as well. After we examine your eyes and learn more about your eyes and your particular needs, we can customize a surgical solution for you. During your consultation, we can also talk about other more logistical issues like scheduling, dates, costs, how insurance works, and we can answer any other questions you may have about the cataract procedure. So we're looking forward to meeting you, and please bring all the questions that you have.